Have you ever been dispatched for a diabetic emergency and found a patient acting drunk, confused, combative, or completely unresponsive? If so, many of you have been dealing with one of the most common medical emergencies in EMS. Today, we're talking about diabetic emergencies. And if you're studying for the National Registry, pay attention because diabetic patients show up on the exam all the time. The good news is you don't need to become an endocrinologist. You don't even have to learn how to spell that word. You only need to understand a few key concepts. Why EMTs care about diabetes. The brain needs two things to survive: oxygen and glucose. That's it. If either one becomes unavailable, the patient starts having problems. And unlike your EMT students on exam day, the brain doesn't perform well under stress without fuel. What is diabetes? Diabetes is simply a problem involving glucose and insulin. Think of glucose as the fuel. Think of insulin as the key that unlocks the cell. Without insulin, glucose stays in the bloodstream instead of getting into the cell where it's needed. Type 1 versus type 2 diabetes. Here's the easiest way to remember. Type 1, no insulin. Type 2, insulin resistance. That's really all EMTs need to know. The registry isn't asking you to become a diabetes specialist. They want to know if you can recognize a diabetic emergency. The two emergencies. There are really two emergencies you need to recognize. Hypoglycemia, which is low blood sugar, and hyperglycemia, which is high blood sugar. One happens fast and one usually happens slow. And that's one of the biggest clues. Hypoglycemia. Hypoglycemia means low blood sugar. This is the emergency that scares us the most because it deteriorates quickly. Patients may become confused, combative, weak, unconscious, or begin seizing. And here's something students often miss. Hypoglycemia can look exactly like a stroke. 1 minute the patient is fine, and 1 minute the patient is trying to fight the couch because it looked at him funny. Low blood sugar can do some strange things. Now, hyperglycemia. Hyperglycemia is high blood sugar. Unlike hypoglycemia, it usually develops over hours or days. Patients often complain of extreme thirst, frequent urination, increased hunger, fatigue, and eventually altered mental status. nremt tip. If the question says polyuria, polydipsia, I hope I said that right, polyphagia, you should immediately think hyperglycemia. The EMT takeaway: when you see altered mental status, don't automatically assume stroke. Don't automatically assume intoxication, and don't automatically assume psychiatric emergency. Always think, could this be glucose? Remember, type 1 equals no insulin, type 2 equals insulin resistance, and hypoglycemia is fast and hyperglycemia is slow. An altered mental status should always make you think about checking glucose. Quick question: which diabetic emergency do you think EMS encounters more often? Hypoglycemia or hyperglycemia? Drop the answers in the comments.